Well, needless to say, many questions were raised this week after health officials called for a halt in distribution of the Johnson & Johnson coronavirus vaccine. This after 6 women developed rare blood clots after receiving the shots. And joining us this morning with more is Dr. Christopher Thompson, who is the Associate Professor of Biology at Loyola University. Thanks for joining us this morning.
Thanks for having me back.
So can you explain to us why they made this decision when it was only 6 out of 7 million? It's been posed the question, your risk of getting struck by lightning is far greater.
Right. Yeah, that's true statistically, but this is a really rare and really scary blood clot that can occur in these people. And so when we already have some vaccine hesitancy, when people are already worried about getting the vaccine and what that would mean for their long-term health, it's the right decision to pause, get more information, and then decide if we should resume. It kind of doesn't matter how rare it is. We need to figure out why this is happening.
And so to that end, what exactly are the steps that are going to be taken to make sure this vaccine is safe to administer again?
Right. So we need to get more information about the women who developed the blood clots and determine more about what type of blood clots they were. And the treatments that we can usually use for these blood clots didn't work in this case. And that's part of what makes it so scary too. So just a lot more research needs to be done. We need to look at the people who have gotten the shots, make sure that we have the right numbers of people. Maybe there are way more than the 7, and it just wasn't reported correctly. So Johnson & Johnson just needs to dive into that data a bit more.
So we know it's been halted here in the U.S., and there are a number of countries that were slated to get really 500 million shots, I think, in some of the African nations. So now global health officials are taking a look at the J&J vaccine. What do we know about that?
Yeah, so we're very fortunate in the United States to have 3 approved vaccines that we can use. Other countries, especially in Africa, are not as lucky, so this is going to be a real issue for them. They may not have many other options, so the idea of pausing may not be as feasible for them. So World Health officials are doing the same thing that we're doing here with the FDA and the CDC in the United States, really looking at that data and trying to find out, is it worth the risk to continue to vaccinate with this, or should we try and figure out some other option?
So let's talk about vaccine hesitancy, because on the heels of the Johnson & Johnson information, we're learning more about some more deaths over in France related to AstraZeneca. And even though AstraZeneca is not approved in the U.S., this is maybe leading to some more concerns for people who are sort of on the fence about getting the vaccine.
Absolutely. And, this is a huge problem. We've had millions and millions of people vaccinated and very few side effects. But the side effects we do hear about are pretty scary and can lead to death in some cases. So I think it's very important to look at the data that's out there. And if we look at what's happened in the United States also, when the Johnson & Johnson vaccine looked troublesome, we immediately paused it. The government is doing everything they can to ensure that this is as safe as possible. And as you mentioned, 6 women out of 7 million vaccinated, not a very high number. We still paused it to ensure that it's safe. The quality assurance and quality control had a wonderful win down at the Emergent Biosolutions facility here in Baltimore. When those 2 vaccines were accidentally mixed, it was caught immediately and it never got out into the country. So we're doing a very, very good job of ensuring safety. And if we see any sign that it might not be safe, we're stopping. And I think that's part of why the AstraZeneca vaccine has not been approved in the US yet.
And getting back to the Johnson & Johnson vaccine, when it comes to women, we ran a story earlier about its potential interaction with birth control, and that story really wasn't very clear what that meant, whether it would interfere with the effectiveness of birth control or maybe cause more issues with clotting, because that's always an issue with birth control pills. What's your take on that?
Yeah, I think the story wasn't clear because the data isn't clear yet.
There
So
you go.
we're still struggling to learn about this. Now, we know that women on certain types of birth control are more likely to get blood clots. And so it's concerning then that Johnson & Johnson, we get this same sort of reaction, but with a blood clot that I said earlier is much harder to treat and it's kind of refractory to the treatments that we currently have. So we don't know the direct link yet, at least I'm not aware of any data that's found a direct link. And that's exactly what we're trying to figure out. Maybe Johnson & Johnson is safe unless you're a woman on a particular type of birth control. That'd be great news, but we don't know that answer yet. So the best solution is to pause and figure this out.
And as for Moderna, they just recently announced that they're planning on doing a booster in 6 months. Really not a surprise. Pfizer had already done this. And so we should expect this not knowing how long this shot is effective for, right?
Right. Current data suggests that 6 months efficacy is probably reasonable, but we're not sure. And so I think we're going to see this as a continuous booster for at least a little while, until we can get on top of the variants spreading and until we can improve our behaviors. The numbers in Maryland continue to go up. The numbers across the United States continue to go up. So until we can get on top of that, I think we're heading down a path for boosters.
All right, Dr. Thompson, always a pleasure to have you on. Thanks so much for answering our questions today.
My pleasure. Stay safe, stay well.
All right, you too.